Like Heather said, really appreciate everybody that's here being here. So many things have changed over the past 2 years in working within the first responder family. And the first responder family, as we're going to be using it, are police, firefighters, EMS, dispatchers, nurses, and other healthcare workers that work in the industry. All of those changes that have come to take place are due to a newfound interest in being able to help us. Because one of the things that they've discovered about us as a group of people is that we are different than what you would determine as typical society. And we're really fortunate in the state of Utah to have, through the University of Utah, the people that are doing the bulk of the research on us, what types of therapies work for us, and the quickest way to get us to where we're well. Two of the biggest issues that kill us in our professions, whether it is short-term or long-term, are suicide and, of course, heart attacks and cardiovascular issues. Both of those can be linked to behavioral health and wellness, of course. And so throughout the course of what we're going to talk about today, one of the things that I want to stress is that they have discovered that our problems tend to be not so much mental illness related per se, they're more of a physical problem. And we're going to go over that. And just like any physical problem, they are things that we can overcome quickly and get back to work. COVID, of course, has, as all of you know, and as all of you are being affected by this, has really affected us in our ability to not only do our jobs, but in how we have to interact with our families when we leave the jobs and how we have to interact with our friends. And it has added to our stress exponentially. There was a study that was just released today on some preliminary COVID information, just talking about how the general public, they're going to see a huge spike in mental health response needs because of everything that's happened. For us, that becomes even more so. And so one of the things that I want to stress throughout this is to please know that you are not alone, know that we have people that can help, and know that you'll be able to do this. You'll get through it. Just a little bit of background about myself. I've been in emergency services, both with corrections, police, and fire for the past 26 years. I've worked at, and currently working at Unified Fire Authority, and I've done a lot of different jobs for them. Currently, I'm their Behavioral Health and Wellness Officer. This is a new position that they've started with the advent of peer support teams. We're going to talk a little bit about peer support teams, so I'm going to save that till the end of the lecture. I have worked with different avenues within our first responder family. I've worked a lot with nurses, respiratory therapists, and healthcare workers on that end, of course, firefighters, police officers, and I've done a lot of work with dispatch and EMS as well. Dispatchers are unsung heroes in all of this. And they're the group that is largely overlooked the most, but that are affected the most by this. Throughout the course of what I talk about, if you notice signs or symptoms that we'll be discussing today in yourself, or if you notice it within other people, please say something. Take care of yourself, because the long-term effects they're finding of what we go through can cause everything from brain damage to cardiovascular damage, which of course leads to memory issues and other death, of course, being our biggest one. But all of these things can make our careers much shorter, and if nothing else, much more difficult to do. The other thing that this affects is our relationships with other people. Many of us in our fields have been divorced. The divorce rate, if you take all of this and put it into context, is about 25% higher than the actual public average. And most of us, myself included, are on our either second or more marriage, have been through divorce once, and the compounding stress that comes with that can be very difficult. I decided to become a therapist. I received a diagnosis of PTSD in 2010. And at the time, they didn't really know much about PTSD and first responders and how we handle it. Since that time, they have figured out that we are different. We are completely different than the regular population. Hold on, I'm just going to get past this. Again, this is a good review of the benefit that Heather talked about. All right. First thing that we need to look at, though, is stress. When I was diagnosed with PTSD, they didn't really understand what that meant for us. And what they started to find is the typical military therapies that they were using for help with people in the military weren't working very well for us. In fact, one of the doctors here at the University of Utah was the first one to discover it. The time I went through it took about a year for me to get through therapy, to get to the point where I was functioning well and healthy again. Now with the therapies they have, we're talking just a matter of weeks rather than months in a lot of cases. And it's been really, really wonderful. But stress is basically, as you can see by the slide, just anything that bugs us physically or mentally. One of the things that's important to know is that stress is relative to the individual. So what might be stressful to you, and even though as a first responder family, we all share some of the same things. Patients, calls that we do, individual issues with administration. Administration is one of our biggest stressors and administrative challenges. Currently right now, COVID. We share all those things, but elements within those are going to be different for all of us in terms of what stresses us out. But we are different than the rest of society in how we manage those things. And because of that, we need different therapies and we need different help in order for us to be able to do our jobs. When I first started with my issues, I didn't really realize that I was doing anything wrong, but people around me noticed it. And I just turned into an absolute miserable person to be around. I ended up alienating myself from my family, getting divorced. I didn't go home in July once, and we're going to talk a little bit more about that, and some of you may be able to relate to that. And in the course of that, ended up getting divorced, went through a really dark period, had a lot of suicidal thoughts and ideation, and called upon my EAP for help. And at the time, our EAP that my department used at the time wasn't very good. And I didn't really get the help that I needed. And there certainly wasn't anybody that specialized in first responders or people in the first responder network and family. In fact, Blomquist Health right now is the only one that truly has first responders that are therapists working for them. That's one of the reasons that I chose to work for them as well. We aren't stuck on session limits like a lot of EAPs are, and we have a great network for referral for people and their families as well when that's necessary. And since that period of time, and after I became a therapist, after I got well, some of the information that I've learned, I was able to apply back into my life. I actually started redating my ex. We ended up getting remarried. We had another kid, and our life has been wonderful now that I'm past those things that were weighing me down. And so I'm coming at this both from a therapeutic perspective, but also from the perspective of a first responder and somebody with PTSD. And my hope is to help you with this information to get on a path of wellness or to help other people that you know get there. So let's talk about a little bit how we are different. First thing that we need to look at is the alarm response cycle. Now, all of us go through this and all of us are trained, our bodies get trained to this. And again, as I mentioned at the beginning, this is a physical problem, it's not a mental problem. This happens to all of us, and it doesn't matter whether it's the patient being wheeled into the ER, the tone's going off, or our radio's going off. Whatever and whichever way the alarm comes in for us, we immediately go from a place of rest, which is that straight line that you see, into a period of excitable behavior. And in that period, a lot of stress hormones are released that we'll talk about in a minute. But When we're up in that area, it takes us about 90 minutes to come out of it. And when we come out of it, we go into a place of exhaustion where our bodies are just physically and mentally drained. And a really good way to look at this is driving in Utah in the winter. You're driving along, you hit black ice, you start to fishtail and skid. Well, when you go into that period, you don't start thinking about all of the emotional problems that you have in your life. You're not thinking about, gosh, who's going to take care of my family? And I wish I would have had a better relationship with so-and-so. What your mind does is it goes into we need to save you and we need to do it quickly. And so you get that rush of adrenaline and everything goes on high alert. And as I mentioned, it takes about 90 minutes for us to come out of that. Well, as first responders, what happens to us 90 minutes after we get a call? It's likely that we're getting another call or we're getting another patient. And so while we're on shifts, we constantly stay up in that excitability phase, and we never really come down. Because of that, what ends up happening is our body starts to just look at it as our new normal. That becomes our new space, and we live there. The problem with that and never coming down is those stress hormones that get released really take a toll on our body. One of the studies that they're doing is on the 48-96 work cycle, but you can apply this to any level of shift work. They're finding that shift work in and of itself, because our bodies go through this, adapt to it and become conditioned to it, is causing us to die at exponentially younger ages after retirement than the rest of society. Our retirement ages are lasting as little as 5 years because of this. And it's something that we need to take care of for ourselves so that we can actually enjoy retirement and our careers in general. The stress hormones that get released are dopamine, epinephrine, also we know it as adrenaline, norepinephrine, which is very close to it, and especially cortisol. One of the things that's important about cortisol is it serves as kind of a signal to our body to manage the stress, and it lets us know when we're no longer being threatened. It lets us know when we can come out of that resistance phase, that alarm cycle. When we go through this and we condition and we stay in that hiked up area, our bodies stop producing cortisol because it thinks that we're constantly being attacked. And our body doesn't recognize the difference between us being on a call or being working with a patient or being called in to provide a service and us being, say, attacked by a bear or being in a car accident. All it knows is that we're under stress, and it keeps us there. Epinephrine, adrenaline, and norepi, what they do in the process is they do things like constrict our blood vessels and make our blood pressure go up, dilate our pupils, open up our lungs, cause our heart rate to increase to adapt to the stress that we're getting ready to take on. And again, right up front, those things are very good. They protect us. But in the long term, they start to hurt us. What happens in terms of the brain, and what the parts of the brain I'm going to be talking about are the front part of the brain, which is called the prefrontal cortex, the cerebral cortex, which is labeled, and that spirally shaped area right in the middle. That's called the limbic system. One of the things that they know that is different about us than regular society is we have a tendency to function from that limbic system more than the rest of the general population. So even coming into this line of work, we're more there than normal. The prefrontal cortex is where most people spend their time, and that's also the part of our body that we do a lot of our emotional processing. What happens is whenever we take a patient or whenever we go on a call, and it doesn't matter what the call is, whenever those tones go off or when we get put into that call, we go into the limbic system. One of the things that the limbic system does, and one of its main purposes, is to keep us from getting emotionally attached on those calls. Think about it. If we have a patient come in and we become emotionally invested to the point of relating on an incredibly personal level on all of those people that we go on, we're going to be incapable of being able to do our job. And so the limbic system really does protect us. But the problem is staying in the limbic system isn't healthy. If you notice at the bottom, there's a little structure within the limbic system called the amygdala. The amygdala is responsible for the management of fear and anxiety in our bodies, as well as rage. And those two emotions are the ones that are at the forefront of the first responder family, and they're ones that we are all very good at. We experience rage and we experience anxiety on a regular basis, but a lot of the other processing that we have emotionally gets stunted and blunted. One of the first things that happened, and 93% of all of our trauma-affected issues come in as marital issues, because our spouses start noticing this, and the people that we are involved in relationships start noticing it first. And they start saying things like, you just don't feel, or you're numb, or I feel like I have to walk on eggshells around you because you blow up at everything. Or even they notice we stop being emotionally invested. Another big one that happens is whenever we feel anxiety, what our job is to control that chaos. And so we start to hyper control everything around us. And so our spouses and significant others will also call us very controlling and micromanaging, things like that. One thing that is common for us too is we get home after shift and we walk in and say there's dirty dishes in the sink. We see that, it completely freaks us out and we get angry, or there's kids' toys on the floor. We get completely freaked out and we get upset and we start cleaning those things. We start slamming dishes, start slamming cupboards, and that starts turning in and bleeding out into rage against our family. And it really causes problems. And that's why the marital issues, like I said, 93% of the time, that's what we see first. Other problems with us living in the limbic system is that part of what the limbic system does is it takes the things that we do through our sensory abilities. So like when we're working with the patient, everything that we experience through our senses with that gets turned into a memory, and it goes into the limbic system to be forwarded for processing. And it'll either go to the cerebral cortex, and that's where our logic center is, or it'll go into that prefrontal cortex where our emotional center is. Well, the problem is that emotional center gets blocked because we're staying in the limbic system, and so those issues build up in there. And every time we go on a traumatic call, or we're running a traumatic patient, or we experience stress, those pieces of the emotional processing that we would normally have get stuck. And it has no place for those parts of our memories to go. We function well in the cerebral area, but we don't do so in the emotional area. And that's where that numbness comes in. Well, one of the things that happens in that process is that in order to help move that stuff out, what our body does naturally is it processes those emotions in our sleep when we dream. And when we go into REM sleep, that's what happens. Well, our body doesn't want to process them because there's no way for it to, and because those memories oftentimes are too hard for us to deal with. And so what our body does is it won't let us sleep. The average first responder right now in the state of Utah, that includes nurses and our healthcare providers, right now is getting 6 1/3 hours sleep when they're not affected. When we're on duty or with the COVID response, we're looking between 2 and 4 hours of sleep. This isn't sustainable. And it decreases our ability to adapt to stress and decreases our ability physically to fight off those stressors. Now, what ends up happening with this is we will fall asleep, and then about 3 hours into sleep, our body will start to process, and then our body says, no, I'm not going to do that, and it shoots out a surge of adrenaline, which wakes us up. This is called terminal insomnia, and then we're awake for the rest of the night. It wasn't that we were necessarily having nightmares, although that can be a problem with this, but we're just awake. And so what do we do to get to sleep? Well, a lot of us turn to alcohol because it helps us relax. The problem with alcohol is it further blocks our ability to process in our dreams, and we don't get true sleep. So that becomes a problem too. Within this, what we're left in our daily functioning is the following: fight, flight, freeze, feed, and breed. Now, I have freeze highlighted in red because none of us really have that. We wouldn't be able to do our jobs if freeze was a big part of our life. Think about that. So depending on the source of where you were, basically, will depend on which one of these or which two of these you run to the most. But for the most part, most of us hit fight first. Fight becomes a big part of our life. We're very aggressive anyway, in that we have to be aggressive in our line of work to help people. But that aggression starts to come out with our families, and we start to fight with our families, we start to fight with our coworkers, we start to fight with our friends more and more and more. And if you see an increase in your fighting, either at home or at work, or you're feeling angry all the time, that's a big sign for you to get help. The second one that seems to happen with us falls under breed. And you would think that's interesting, but what breed has to do with is hypersexuality or hyposexuality. What usually happens at first is our libido goes down. In fact, in men, what that equates to is lower testosterone levels. In the first responder family, we are one of the highest demographics of synthetic testosterone use in men under 40 out of any other occupation. And then after a while of being in that excite stage that we illustrated on the previous slide, what our body thinks is we've been under attack for so long that we had better start to propagate our species because we're going to die soon. So then our libido shoots through the roof and hypersexuality becomes a problem. We see a lot of marital infidelity. We see a lot of people having a lot of sex but not making love anymore. There's not a lot of feeling in sex. We see a lot of pornography and sexual addiction. Masturbation goes through the roof. We see a ton of that take place, and it's all because our body is dying to feel. Because our prefrontal cortex isn't working the way it should, our body uses sex as a means for us to feel, and it uses fight the same way. The third thing that happens is flight. And we run away from problems, but we don't do it in a way that equates to freeze. We are the people that run toward problems. So what we do is we run away from ourselves. We don't like to sit still with ourselves for any length of time. And we manage flight, most of us do, by working like crazy. Most firefighters and police officers and nurses have a second job somewhere, or a third job, or a fourth job. And we work constantly, or we take overtime shifts like crazy. And we justify that by going out and buying the $60,000 truck, or the toy hauler, or everything else. And y'all know what I'm talking about. Well, what ends up happening with that is we use it for 2 seasons on the average, but then we're so much in debt that we have to continue this drastic cycle of working. And if we're not working, we're busying ourselves with a bunch of projects that we never seem to finish. We also use flight by drugs and alcohol. And again, we've talked a little bit about how that affects us. And sometimes we'll use it in ultimately suicide. That becomes our ultimate way of flight. The next way we do it is through feed. We all have a tendency to satisfy that limbic need, and so we eat fast, we eat unhealthy, we eat too much, and because we're working all the time, we're too exhausted to go to the gym or work out or get the exercise that we need, and we certainly don't add in any time for self-care in this process. We neglect our families, we neglect our relationship, and pretty soon, again, we alienate ourselves, and that's when we start hearing those complaints from our families or our significant others. The other thing we do is we stop validating our families and significant others because we're hyper-focused on just the immediate needs of what we're doing. And we justify it by saying, I'm working this hard for my family. I'm working or I'm doing these things so I can promote, so we can have more money. It's not that. We're running away from ourselves because we don't like sitting with that empty anxiety feeling that comes with the job that we do. We don't like sleeping because of the nightmares. We don't like engaging because we don't want to interact with other people. And pretty soon we're only engaging with other people that happen to be within those various subcultures of our family. Firefighters hang out with firefighters, nurses hang out with nurses. And when we do hang out, most of the time we're drinking or we're doing stuff in excess. And it becomes a big problem. So what do you do about it? Well, the first thing is recognizing that there's a problem. The next thing is making sure these things are taken care of. And if these things are not, again, these are red flags that say, I need some help. The first thing is diet. Pay attention to your diet, watch your portion sizes, eat slower and eat healthy. So much of what we do is spent at fast food places or just eating quick. And that's particularly so with COVID because everything is takeout right now. Or it's being provided to us by our places of work. And so pizza just becomes a staple because it's something that departments can easily get and it's quick. I hope I never see pizza again when this is done. Start paying attention and packing your own lunch meal plan and make time to do that. It's essential for your health. Relationships. If you find yourself isolating or isolating just within your group, that's another red flag. If you find yourself going home and just getting on your phone, that's a red flag. If you find yourself just wanting to escape and not even paying attention to the way that you're escaping, that's a red flag. Our phones, these phones become such a detriment to our health. We communicate on Insta, but we don't communicate anything. Some of us still actually use Facebook, and we do it there too. But realistically, it's not healthy. That's not a real relationship. Get exercise. And exercise doesn't mean you have to go run that marathon. It means go out and go for a walk. Take a break and get away from work. Watch your sleep. If you are 6 1/3 or under, reach out to us. You need some help. And then your stress load. Our stress loads right now are just well beyond what they ever would be normally. So don't add to that by adding a lot of projects right now or saying, I'm going to learn a new language or I'm going to go back to school and get a new degree. Now is not that time. Keep your stress load manageable and add at least a half hour of your day for self-care, doing something that you want to do to unplug. Meditate, pray, go play that video game, read the book. It's not COVID, it's just a cough. Take that time to watch a movie, take a bath. When you can get a massage again, get that taken care of, but find a way to have that self-care. The other thing you can do is establish a peer support program if you don't have one in your department, and if you do, start building it up. Peer support is a new thing. About 2 years ago, Utah State Legislature passed through Utah House Bill 13, which gave public organizations the ability to establish peer support groups, which gave people within our working environment the ability to have the same confidentiality provision as counselors, with the exception of adding on if you are about to commit a crime or have committed a crime. So your peer support members can provide peer counseling and provide confidentiality with the exception of the following. If you're planning on hurting yourself, if you're planning on hurting somebody else, or if you're abusing a child or a vulnerable adult, or if you have a communicable disease and you're intentionally spreading it. All of those things we are all bound to anyway as mandatory reporters. If you're going to kill yourself, they do have to set up a plan with you that involves other people. So confidentiality needs to be violated to some degree in that process, but it doesn't mean they need to tell administration. In those situations, we can have a safe place to unload and talk to without fear of it going to admin, without fear of it going around. So if you don't have a peer support team, please talk to us because we can help you establish one within your organization. We've set up quite a few in the Valley so far, and they're a huge asset just to have somebody to talk to that's a peer within your own community. The next thing is if you see something, say something. Our culture is notorious for talking about problems with everybody but the individual that the problem exists with. So often we see people that we know there's a problem with, but we don't ever say anything because we don't want to make waves to rock the boat. We have to take care of each other. We have to see ourselves as family, and we really have to step up and say, hey, you've been calling off sick a lot, or hey, I can tell you've been crying at work a lot lately, or hey, you just don't seem like yourself, or hey, when we're going out, you're drinking way too much. We have to say something and help our brothers and sisters get help. And then the next thing is be vulnerable enough not to be afraid of therapy. I can promise you, I'm going to be the one giving you some of that therapy, and it's no different than training. It's no different than what we're doing right now. And there are very specific therapies that are more useful to us than others. Therapies like EMDR, therapies like CPT and CBT, cognitive processing therapy, and cognitive behavioral therapy, things like exposure therapy. All of these things are more useful to us in this network of professionals than other therapies. They're finding talk therapy really isn't that useful. And we can help you, and we can determine which type of therapy is best for you, and we can work forward with it. And like I said, a lot of it requires actual physical exercise to make therapies work. Mindfulness is another big one. We have huge resources for you in that category, and helping you get well, and helping you be more strong, and helping you be more resilient, helping you be more healthy. All of the professionals at Blomquist Hill have been trained in something called Mind Shield, which is a type of therapy that was made specifically for us. And it's awesome. And it takes 2 sessions to become proficient at it. If you just want something to help you be able to manage stress, Mind Shield is something that we can do with you. And it's something that works so well and so quickly. I use it with pretty much every one of the people I see, and I personally use it. EMDR helps us process those memories that are stuck. Cognitive processing therapy helps us overcome some of our negative thinking and beliefs that go along with our job, like mistakes equal death. So much of us are programmed that mistakes equal death, and that happens when we start EMT school, or when we're in the academy, or you're going through nursing school. If you make a mistake, somebody's going to die. The problem with that is we become very unforgiving with ourselves when we make mistakes, and pretty much every mistake we treat like somebody died. So we are late with dinner. When we get home, it feels like somebody's dead, or some catastrophic thing happened because of that. The dirty dishes in the sink. We treat that as being a huge mistake, and it overcomes us, and we're pissed off the rest of the day. We don't have to live like that. Our families don't have to live like that. Something that really can be fixed. We can help you. When we help you set up a peer support team, we give you advice, we give you guidelines, and all of the departments and all of the people at Blomquist Hill have different areas and organizations that we are over. We will be there for you 24/7, as Heather suggested. We'll be there to take care of your needs. We'll be there to help you and your families. And the thing that you have to understand is a lot of times, many of you have gone to therapy and you said, they just didn't get us. I do. I've been there. If you're a firefighter or a police officer, I get it. I've done nursing in hospitals. I get it. And there are many of us that have the same backgrounds that I do, and we do get it. And we will help you. Now, what if you go to a therapist and it's just not a good fit? That's okay. We have a bunch of other ones that can help too. What if you want to see a specific therapist, but they're booked? It's okay. We have other ones that can do the same thing. But the one thing I want you to understand through the course of this is you don't have to do this alone. That this is a physical problem. We can overcome it together. And that you can get past any struggle that you have. You might feel like your marriage is hopeless right now. Don't throw in the towel until you get some help. You might feel like you're never going to be able to get through stress or sleep or the debt you're in. We can help with those things. A lot of people ask, and they come right up because so many of our professionals that I'm talking to right here are in the medical field. And a lot of them just want a pill to make it go away. I can tell you, as a person that is on meds for anxiety and for PTSD, I can tell you that that's not my first resort, is to get you hooked up with medication. Because most of the time you don't need it. Through therapy, you can get through this without that. But if you do need medication, we have resources that can help with that as well. You aren't alone. We can help you, and we'll get you through it. If you feel like you're a threat to yourself, you feel suicidal, again, I know what that feels like. Don't suffer with it. Don't wait for it to pass, because your body will hold on to it. Come see us and get help. Now, 2 things that I ask people to do. The stuff that I've gone over today, I've gone over really quickly. One of the things that you can do is, there's a wonderful book called The Body Keeps the Score. It's one that I recommend everybody in our first responder family read. It goes over everything that I talk about. You can get it on Audible. It's one of the best things in understanding the process that your body goes through. You don't have to read the full book. A lot of it gets into types of therapy, and you can read the whole book, but the first 4 to 7 chapters are what you need to know to understand what your body is going through with this. The other one that I suggest that everybody read, and anybody that works with me, this is an assignment. It's one of the first things that we do. Listen to, it's only available on Audible, listen to The Power of Vulnerability by Brené Brown. Brené, I swear to God, she didn't write it for us, but it sure seems like she did. Everything she talks about will resonate with you as a first responder. And that seminar that they taped her doing in The Power of Vulnerability is fun to listen to. She's really funny. She's a professional. She's a PhD and a research statistician, and she knows what she's talking about. I'm telling you, that book will change your life and do so much for you in terms of being able to open up and relate to what you go through in the job and understand that you are enough. Trust me, it's a life changer. Again, that's The Power of Vulnerability by Brené Brown, and The Body Keeps the Score. The physician that wrote that, his name is Bessel van der Kolk, and he is also an amazing professional in our field. All right, with that, are there any questions that anybody has, or anything that I can answer for anybody?
Again, you can ask your question by just holding down your space bar, and that unmutes you, or you can type it in the chat. So while we wait for those questions, we did have one come in. So they said, could you ask tips on how to convince the first responder spouse that they need help and it's okay to ask for it?
Okay. One of the biggest ways to do that is establishing a peer support group. Depending on the group that you're with, most organizations have specific training already in place to help your peer support team do just that. If you don't have a peer support team set up, talk to us and we can help you do that. If your admin is against that, then what you need to do is, when you do notice something, say exactly what your question said. I'm noticing that you are, and then fill in that blank. And then go up and say, it's okay to get help. Part of it is to get help yourself. You don't have to be, you can say to yourself, I'm not ready to jump off a bridge, so I don't need help. Like I said, if you notice any of those things I said, if you're not sleeping well enough, if you find yourself being irritable, if your sex drive is up and down, if your diet is either you're eating too much or not eating at all of those are red flags that you need and can use some help. And so then just go and get some therapy for yourself, experience it, and then you can tell people what it's like. And they can see that it's not a big deal. They can see that it's very much just like training. The last thing is have us come and talk to your departments. Have us come and talk to your nursing department. Have us come and talk to your group of respiratory therapists. Have us come and talk to your precinct. Have us come and talk to your station. We're more than happy to do it, and we do it all the time. We can come out and help with that whenever you want.
So that question was actually from, I think, from the spouse. So
okay.
She or he wants advice on how to convince their spouse, who is a first responder, that it's okay for help. Would you say the same steps, or?
Yeah, so with spouses, I do a ton of work with spouses. And I get this question a lot from spouses, so thank you for asking it. One of the things that we do is we sit down together, and I work with you initially. I find out exactly what's happening, and then we do a couple session where we bring it up, and I present this information. Once the firefighter, the police officer, the nurse, once they hear it, a lot of them are very relieved because they recognize the symptoms in themselves, and they say, okay, this isn't a mental issue, it's a physical issue. My brain is just operating out of one specific part. And then when we set up a treatment plan and they realize how we get you to turn off and leave work at home so your brain can shift, most of the time they're really, really into it. And you would be surprised at how many of their cohorts in work have already been through this. And a lot of them are really open to talking about it with their peers. And so if there is somebody in their organization, and I already know that somebody has volunteered to be a spokesperson, like say it's UPD and the police department, there's a ton of people that have received help, and they say, if anybody ever needs help, have them call me. I just give them the number, and then they can call one of their own brothers or sisters that they work with and get that help. It's pretty awesome. So it takes more than just one person, basically, but we get it done.
That is awesome that you have those resources that you can provide for them and those connections. That's cool. Any other questions? We haven't had any more come in. Like I said, you can unmute yourself or type it in real quick. While we wait to see if there's any more, again, I just want to remind you of your benefit. Like I said, you can call our office and let them know you're a first responder or a healthcare professional, and they're going to pair you up with somebody with Lane or one of our other therapists that specialize in that area. So we want you to know that we're here for you, and we'll support you the best we can.
Can I ask a question?
Yeah.
So what if you're a department head, like you're, say, the head of Air Med, or you're a chief of a department, or a sergeant over a precinct, or a chief over a battalion, and you want this training, and you want people to come out and do training with the people that you have over, how do they go about doing that?
To schedule something? So yeah. They can reach out to me directly, and then I'll get it figured out and get in contact. So my email is just heather@blomquisttail.com. Or you can call our office at 801-262-9619 and ask for me, and then we can talk about getting something set up.
Okay, cool.
And then we've got 2 questions or comments.
Sure.
So the first one is, for counseling appointments, does insurance carrier matter or just company association required? So that's a really great question. So it's actually just company association. So we don't take any insurance. We partner with organizations across the state and the country so that employees can have access to counseling services at no cost. It's HIPAA compliant. And like I said, we want to pair you up with somebody who has experience in your area. So yes, it's just based off the company you work for.
Can I add something to that too?
Yeah.
That always comes up with this. A lot of people don't feel comfortable coming into the office. If you're more comfortable being seen at your station or your precinct, I do the vast majority of my work out in the field at people's stations and precincts and offices. And so that is available too. And again, like Heather said, we don't do anything with insurance or anything like that. So we're not going to hit you up for a copay when we get there. Like that. This is free, like she meant.
Yep. And just talking about, someone made a comment that they had Corey come out and talk to our public safety spouses at our city, and it was great. It was very beneficial for them to understand what we go through and how your spouse can help from home. They wanted to remind everyone that there are so many tools available to help you at work and at home. So thank you for that comment. And yeah, we're here to help. And then there's one more question. Can you tell me if there are agencies around that are mandating mental health check-ins? If so, what are your thoughts about this?
That's a super good question. So the way the law is written, it says you don't have to have a peer support team, but if you do, you have to follow very specific guidelines in it. And more and more, because more and more agencies are getting peer support teams, one of the things that's recommended with that is yearly checks. Yearly checks are a great idea, not to determine fitness for duty, that's not the point, but it's to give the individual basically a checkup. We check your stress levels, we check how you're managing, and we do it through some questionnaires and just personal interviews. And if we find areas that you may have red flags, for example, if you're not sleeping, we set up a program called a sleep hygiene program to help you get that sleep. If we find that you just want to unload and talk about a difficult call you went on, or a difficult patient that you have, or whatnot, you can do that in that yearly checkup. If you're having reoccurring nightmares about a particular call that you went on months ago, that's something that we can talk about. All of those things are really, really easily managed in that check-in time. And so many people say, yeah, I know I need help, I'm showing these signs, I'll get it later. With mandatory yearly check-ins, you don't have to worry about it because you're going to hit it during that point. So the procrastination beast that we all seem to be very good friends with can't rear its ugly head. It's just taken care of there. So I'm all for them. In our peer support team, that is something that we are looking at doing right now, is setting up some sort of annual checkup. And we do hire, we actually do stress assessments and then provide those stress assessments throughout the career to make sure that from the baseline to where they are, say 7 to 12 years, that nothing's happened. And that's another thing I forgot to mention. We start seeing people falling apart from these effects about 7 to 12 years in. That's the average time we see marriages start to dissolve. That's the average time that we see alcoholism on the job go up. That's the average time that we see arrests for domestic violence and DUIs happen. It's all in that 7 to 12 year range. So that's another red flag. If you are within that range, you're a higher risk.
And then with that being said, the mandated mental health check-ins, we have some organizations and cities that that we do that also for them. So they're mandated to come in once a year by their city or organization and meet with one of our therapists. So yeah, it's definitely out there and pretty cool. And then, have you heard of any programs to keep in touch with retired officers? I know they are at higher risk for suicide a few years after retirement.
Absolutely, and great question. One of the things that we suggest is putting a retired person on your peer support team. If they are retired, most departments are paying their peer support team. It doesn't violate their separation agreement as long as they don't make over $16,000 a year. And if they've been separated from the department for a year, it doesn't affect them at all. We actually have 2 retirees on our peer support team right now, and they are a great asset. So that's the number one area. The second is working within the organization to make it so your benefit extends to retirees as part of it. And Sean Morris is somebody that I know different agencies have talked to about it. Sean works for us. And so those questions can be directed to him and how it might be able to work within your setup with Blomquist Health. Unfortunately, there aren't any specific like FOP or IFF structured things that you can stay within those organizations as a retiree, but there isn't anything specifically set up in full force yet, but they are getting there. They're working on those things and making it a part of it. So because this is relatively new, most departments are only seeing this within the past 2 years. Those changes are being taken place and they are going to happen. They're just not set up quite yet.
Awesome. Okay, that is all we have for questions. So do you have anything else you want to add, Lane?
No, just thanks for being here. Thanks for giving a damn about your people and yourselves. And again, if you see something, say something. Don't go through this alone. You don't need to. And if you're a spouse and you're seeing this in your significant other, reach out to us. It's confidential to them too. And so we're not going to, your spouse won't know that you're there from us. And we'll get you on a pathway and a plan to help your relationship get better.
Awesome. Well, thank you, everybody. And I hope you have a great rest of your week. Thanks so much for being here. Bye-bye.